Hello everyone. Today we have got Tanuja Masand with us. Let me introduce first Tanuja to all of you. Tanuja comes with more than 20 years of experience, specifically in the IT industry. At present, she is the group head corporate development at Coforge. If I talk about the kind of roles and responsibility Tanuja has delivered, so she has been a high visibility strategic partner and a thought leader with highly rich and diversified cross functional experience across multiple roles, to name a few, like corporate development, chief staff support, large deals bid management, sales operations, Salesforce CRM, knowledge management, whatnot. So we are really grateful and privileged to have Tanuja on our industry advisory board for the MBA Hospital and Healthcare Management program at IIM Bodhgaya. Thank you so much, Tanuja, for being for showing your support to IIM Bodhgaya.
Thank you. Thank you for the warm welcome. Glad to be here.
Yeah. So may I start asking few questions to you?
Sure.
Yeah. So now, first question would be more of about industry trend, specifically into IT and healthcare. So now, as we know, that healthcare IT has become a new buzzword. So when we talk about this healthcare IT, as you have got vast experience in the IT industry, now could you tell us the few trends about the key trends in the healthcare IT space? And being in a strategic role in IT industry, how do you look forward that these IT firms are basically thinking or looking forward to healthcare industry or healthcare vertical as revenue potential in future?
Yeah, great question, Swapna. So basically, we have been witnessing this massive growth of technology, especially if I talk of AI-driven technologies and complete digitalization of healthcare workflows, and rising demand on accessible and quality medical services and patient care, remote services. In the last 2 years, especially during pandemic, we have witnessed massive growth of this sector, and the demand is rising. The trend is just going upwards. As I've seen that number of healthcare organizations, they have joined hands with IT as well as IT enabled service providers to transform basically the delivery and of their products and their services. So it's both. First is the delivery of the products in time, and the services, all the services related to hospital and healthcare administration. So I've seen massive growth in this area, and pandemic has actually accelerated the digitalization of healthcare industry. So, if I talk about figures from Healthcare Information and Management System Society, which is US based, and according to latest healthcare report, they have said 80% of healthcare providers, they have planned to increase investment in technology and digital solutions over the next 5 years. So you can imagine the massive growth of this domain and the focus. It's a complete shift of focus, you can say. Everybody is realizing that importance of remote care for at the comfort of their house. You can have telemedicine services. You can consult your doctor. Your medicine can be delivered at the doorstep and whatnot. Your diagnostic reports are there. And if I talk about all that hardware and the machinery and OT, everything, the infrastructure, administration, everywhere IT has left its footprints, and it's growing day by day. So I feel that if I talk about the trends, definitely I see a lot of growth in areas like telemedicine, personalized medicine, genomics is the area. Then wearable devices, we have seen smartwatches, wearable devices. It has a lot more than a watch. It controls so many things. It tells you, it completely shows on the dashboard what is your oxygen level, etc. Just to name a few. Cloud computing is one area which we are also focusing as an IT enabled services. Also blockchain, wherein you can kind of integrate it. Right now what is happening, like every hospital has their own records, the patient records, and they're working in silos. So the plan is to have the complete integrated hospital management system with the help of blockchain. Internet of Things is also one growing area. And if I talk about robotic surgeries, I talk about like virtual reality, which has already been entered into this growing field of healthcare industry, centralized command center, telehealth, to name a few. And the most important thing is the data, which every IT company is focusing in a big way, big data, because it's a huge humongous data that we need some health experts, data experts to control and manage, so that analytics can be taken out. Preventive health management, it's a growing area. If my, suppose a person 40 years of history, what the medical records is, digitalized format is there, analysis being done, what kind of, prevention he should take care, lifestyle, diet, he can prevent so many diseases, being, getting that information in advance. So health analytics is also a very big area that I see has a great potential to grow. So here I have certain other things that I really would like to share, to name certain growing trends. So I would quickly list, in the interest of time, 5 trends which I feel we have great demands in this area. Like artificial intelligence in healthcare, big role to play. Second trend, I feel telemedicine and evolution of remote care is going to rise next 5 years. Like there will be a boom in all these services. Extended reality in health settings, IoT wearable devices, as I covered. Then finally, I feel healthcare privacy and security. So now we have seen in the banking how the cybersecurity things are happening, how the breaches are happening. So those are the learnings. Now, if patients are not comfortable, sharing their health records, then the trust has to be won with the help of a bill that government is already, working on this healthcare privacy and security bills that has to be implied, so that the data is confidential and secure, and everybody, I remember years ago when, we went to like digital banking, we were scared, like our data, our money is there, and how can I share my accounts, how can I, go digital. But with the help of trust, we've been able to transform this industry completely. And so do I feel that healthcare need digitalization, complete transformation, and that with the secure security of data, everybody would like to avail this. So here I stop. I think I've covered and answered the question. If anything else, Swapna, you can I can share you further.
Perfectly fine for this with the time constraints we have. Perfectly fine. So as we can see, the decades of experience talking about and on about the trend that you are talking about, right? That's again great to have you today, or to host you. Actually, it's my pleasure. So basically, if I summarize your answer, then it's basically as you said, or normally we have been also saying traditionally, that prevention is better than cure. And similarly, the healthcare industry is moving from a curative standpoint to a preventive health standpoint. And that's why you were talking about all these AI, IoTs, or telemedicines, remote care, etc. Everything has come up into force. And obviously, that's why the digital health or the IT healthcare domain is actually growing, or bound to grow, I think, by lips and bound, right? Yeah.
Truly said.
Thank you. Thank you for such great insights into the healthcare IT. So that sets up my next question. Now, since we are at IIM Bodhgaya, we have launched this healthcare MBA, Hospital and Healthcare Management program, which is a 2 years full-time program. Now, what do you, based on your, like, you have been experienced, vast experienced in IT. So where do you feel that with the growth of the healthcare IT domain, where do you feel that this healthcare management graduates will fit into these IT firms? And if at all required, or if they fit in, then what kind of actually skill sets they would be requiring while they will be graduating?
Great question. So I would say bright future, plenty of opportunities, plenty of roles, and list is exhaustive, I should say. But I just name a few. For example, healthcare managers, program managers who are looking after the total hospital, administrators, healthcare data analysts, health management consultants, product managers, business analysts, they understand the business also along with the data, market research analyst, business development managers, subject matter pharma quality managers, operations managers, quality improvement manager at the hospital information manager. These are the areas where we see we cater to the customers, the projects we undertake, like IT enabled services. They have huge projects from whatnot, other continents, Europe or US, wherein this digital records of health is already there. It's accessible, it's secure, it's already there. So those projects are there, wherein there's a huge demand of such professionals and whatnot. You can just climb the ladder of this noble profession, I would say, and you can climb up to the level of COO and CEO.
So we are really excited to know about this. And obviously, yes, the students who are thinking to make this as a career option, they would be also happy to know this.
Definitely,
Yeah,
definitely. I've
yeah.
seen so many domain experts who are already with the healthcare domain knowledge, and coupled with the IT background, which definitely this course is going to provide, and there's no looking back as far as career is concerned.
Yeah, and to be on my part two of that question, I also wanted to understand what kind of skill sets they would require to join an IT firm with this healthcare background, or maybe with this healthcare education background.
Okay. Having said that, I would say we really look for analytical skills in a graduate, a management graduate, because to understand the regulations, adopting to new laws, which is very important. Then detail oriented skills, paying attention to details, organizing, maintaining the scheduling, billing for facilities like hospitals. So you want should be attention to detail is the quality. Communication skill I really admire, and I really see that helps you grow faster. Effective communication to convey policies, for example, procedure to other health professionals you are interacting, ensuring compliance with current regulations law. Herein communication skills plays a huge role. Interpersonal skills like discussing problems, staffing problem, patient information, other professional, physicians, health insurance representatives also. So interpersonal skill. Then leadership skills, of course. When you climb up the ladder, you have teams, rather you have multiple teams to monitor and manage. So hiring, training them, motivating, leading staff, finding ways to create, solve start staffing problems, administrative issues and whatnot. So leadership qualities, of course. Along with that, I really feel some amount of technical skills. Since we are talking of IT and IT enabled services, you should be familiar with the current trend in health technologies advancement. So what IoT is, what IoT is, how it's helping, what is blockchain, how it is helping consolidating hospitals data analytics. May not be in detail because you are just managing it, but if you have good knowledge about IT, it will take you higher and higher, because future is technology coupled with your domain. So if you are really interested in going into technical area along with in this domain especially, so I would say coding, classification, software usage, because electronic health record. Yeah, one more information I wanted to share. When we were talking about trends, so government of India already launched an app which is called My Health Record. It is very much active. Only problem is it is not being uh, popularized so much that awareness is not there, the trust building is not there. But that is the future. Electronic health record, it is the record. You can keep all your reports, your diagnosis, your analysis, analytics also. Their dashboard system is there which predicts your health, how currently it is, and the alerts it provides. So having said that, electronic health record is going to be the future. As we have every record, the banking record is on the touch of our mobile phone, we can access anytime anywhere. Similarly, this is going to the future. We'll access our health record anywhere in the world we go. We can have at the in our hands, in the mobile or web, whatever we can access. So definitely I would say, if one is interested, so have some neck for current trend in healthcare technologies. What is the advancement, what is the future? And if you want to go into deeper, yes, there's a bright future, especially with the coding and the softwares, maintenance, and support system.
Yeah. So to summarize, I would only say two, three words that you said, the catchy words from your lines, quote unquote, that combination of technology with the domain knowledge. That's going to be lethal, and it's going to be proven to be assets for anybody who is going to, looking forward to make career in this domain, right?
Yes,
Yeah,
rightly said.
perfect. So coming to the last part of my questions, now since you are already in the industry advisory board for the hospital and healthcare management program, so what is your opinion about this program or the curriculum that we have designed? And what would be your message to the students who are aspiring to join this program and build their career in healthcare IT domain?
Great question. So I had actually looked at this course, and I really felt it's an innovative and much needed program, which is targeted to equip, budding healthcare managers, or rather, I would say leaders, with not only the domain specialization, but the real time experience, the application part, which I really like. This is the best part, USP of this course. Also, I felt two tracks that you have decided. So, students have choice either to go one track like hospital management or healthcare management. So, uh, having said that, the domain specialization along with that practical course at the end of first year, that extended duration of 4 months industry immersion, that's wonderful. Hands-on approach, which I feel is much needed, which I personally feel the campus to corporate gap definitely is going to fill. And students will be involved in the community project in sixth term, which is marvelous, which is marvelous in this course which you have designed. And I congratulate you and your complete team for having this wonderful program in the public health schemes. Government's already making effort, IT already making efforts, everybody's joining hands, and so do our education world. I'm glad to look at this course.
Thank
uh,
you. Thank you so much for this encouraging feedback.
yeah,
Yeah,
surely.
and we are also sure that with you on our advisory role, so we will definitely create that positive waves in the education world as well as in the digital health world, and we will obviously, I think we'll be able to minimize that corporate to campus distance that we talk about.
Yes, yes, campus to corporate
Yeah,
gap.
campus to corporate. Yeah, so rather that's the right term.
Yes,
Yeah,
and
thank you, thank you. Yeah, thank you
I
again. Yes.
yeah, I just wanted to leave on a note the message which I was thinking to convey to the aspiring students who are thinking at looking at this course and thinking on the decision part. I would just leave the message for them: just go and change the healthcare world. That's the message. Go and change the healthcare world, because I feel we're in the world a world where pizza or the groceries can hit our doorsteps in less than 10 minutes. Then why not the life-saving emergency services such as ambulance or medicine, or even an expert advice, at the remote or far-flung areas? Why not just make it a reality?
Yes, and absolutely, we together can also create those change makers. Yeah,
Yes,
thank you so much for this interaction, and we would look forward to interacting with you more and more. Thank you
sure.
again so much for your valuable time and inputs.
Thank you so much. Thanks.